Our presentation is a health assessment scenario on alert leg swelling and blood clot story. This is presented by James Gazy, Sandra Osu Asifi, Megdiscalo McFenta, Ramatu Mohammed, and we are in the group B. The image introduces the students and the role that they played. Next is the client's overview. The client's biographical information is she is Annette James, 61-year-old female, married, an accountant, living with the family. She's in Edmonton, and a contact is below. With a past medical history, she had history of blood clots, she's hypertensive, and she has arthritis, she has right knee surgery, she's on propranolol, oxycodone, and amitriptyline, she's allergic to penicillin and dust. Family medical history, she has family history of hypertension, blood clots, as well as obesity. And family members also have DVT and varicose vein, and there are no other medical conditions. With a social and lifestyle history, she lives with the family and has two children. She's a non-smoker, occasionally drinks. She engages in physical activities. She takes food rich in high fiber, minerals, and vitamins, and she gets adequate sleep due to her current situation. With a mental and social support, she gets support from families and friends as well as a healthcare team. And with stress and anxiety and depression, it's normally held by the social services and community resources. She gets no caregiver needs. Assessment summary and recommendations. She is encouraged to continue monitoring for potential embolism, and she also considered to having physical therapy and home services as well. And she also gets support from the social work, which helps her to access transport. She's encouraged to have low impact exercise as well as has dietary adjustment. With a client summary, she is Annette, 61-year-old female accountant, married with three children. She presented with right leg swelling, diagnosed with a blood clot and a risk of pulmonary embolism. She is hypertensive and she has obesity and arthritis. She is currently on propranolol, oxycodone, and amitriptyline. She had past surgery on the right knee. She's allergic to dust and penicillin. She's a non-smoker, drinks occasionally, married, and she gets support from families and friends. And recommendation is to continue monitoring for any other complication as well as promote physical exercise. Next is a role-playing clip that shows how health assessment is done on a patient with leg swelling and blood clot history.
Hi, hi, I'm Ramatu and I'm the nurse.
Hi, I'm Magdas and I'll be the patient.
I'm Sandra and I'll be the doctor.
Hi, I'm James. I'll be the videographer and editor.
Hi, my name is Ramatu. How are you today, Mrs. Anne?
I'm good. How about you?
Okay, so I'll be doing a physical exam on you, specifically a peripheral vascular. Is that okay?
Yeah.
Okay, thank you. First of all, just hand hygiene. I'll provide you some privacy. Pull the curtain. Yes, can I have a look at your ID band?
Sure.
Okay, can you confirm your name for me
Yes, I'm Annette James.
and your date of birth?
December 12th, 1996.
Okay. Are you comfortable?
Yes,
If
yes.
it's okay, I'll just put down your bedrolls a bit
It's
to make
okay.
you
Yeah,
feel my
thank
level.
you.
And I see, okay, your call bell was within reach. That
Yes.
is great. First of all, what is, do you know where you are?
Yeah, I'm at Northwest Hospital.
Okay, do you have an idea of the date?
November 25th,
Time?
around 12.
Do you remember who I am?
Yes, you're my nurse, Ramatu.
Okay, so it's good to see that your level of consciousness, you're oriented to time, to place, to person, and to self. So that's great. Um, we've already done your vitals earlier. So I took your blood pressure, your pulse, your temperature, and SpO2. And of course, I already have that documented. Okay? So I'll be asking you a couple of questions. Can you confirm your allergies for me, please?
Yes, I'm allergic to penicillin.
So What happens when you're exposed to penicillin?
Yeah, my body's going to be very itchy and I will have all rush.
And that's your reaction. You don't have any other allergies.
I am allergic to this
Okay.
and my asthma will be exacerbated.
Okay. So I'll be asking you a couple of questions, please, with regards to your pain.
Okay.
So, do you have any pain?
Yes,
When did the pain start?
2 months ago.
Okay. Is there anything that increases your pain?
Yeah, when I'm walking around, it's getting worse.
And what makes it better?
When I'm doing a cold compress upon my leg, it's getting better, you know.
Okay, I'm sorry to hear about that. Okay, so can you tell me what the pain feels like? Is it dull? Is it sharp? Is it
Oh, it's
aching?
very burning pain.
Okay. So where precisely is this pain located?
Lower legs. It's actually on both my leg, but it's very worse in my right leg.
Okay. Does that pain radiate to any other part of your body?
It's actually radiated to my ankle.
Your ankle.
Yeah.
Sorry to hear that. Okay, so in terms of severity of your pain, right? From 0 to 10, 0 being the least and 10 being the highest, how would you rate this pain?
I would say 7.
7.
Yeah.
So for treatment, have you taken anything for the pain so far?
They gave me Tylenol.
Tylenol. Do you
Yeah.
know the dosage you're taking?
Honestly, I don't know.
Okay. So this pain, in terms of like time, when does it occur? Is it frequent? Is it constant? Is it on and
Oh,
off?
it's constant. I have been in pain for a long time.
Do you know what is causing this pain? Do you have any idea?
I think it's due to the surgery I have.
Okay, you had a surgery.
Yes.
Okay. So in terms of how you would want to see the level you want this pain to be at when we're done, like treatment, from 0 to 10.
It's 2.
And
2 is
2.
okay. Yeah, 2 is okay.
Okay. And then also, is there any other thing you want to tell me about the pain?
No, I'm just in pain.
Okay, you're just
Yeah.
in pain. So are you feeling any numbness or tingly feeling or cold in your
Yeah,
leg?
my feet really feels cold and
Okay. Do you have any idea when that started?
2 months.
Okay. Have you been taking what kind of treatment have you taken?
Just Tylenol.
Just Tylenol.
Yeah.
Okay.
And I do cold compress.
Okay. So I will want to do a physical on you just to check your limbs. Is it okay? I'll be touching you at some point. Is that okay with you?
Yeah, that's okay.
Okay. So first of all, the first thing is I want to just inspect. We want to see if you're having any changing coloration in your leg, and then of course I'll be checking the temperature to see, because if you are having, let's say, like cyanosis, we would expect to see maybe bluish coloration, and then of course for your temperature, if there's anything going on, you'll probably feel your lower extremities will be cold. So on inspection, I'm seeing that there's no discoloration or anything. It's just a little bit redness that I'm noticing on the right side of your leg right here. And then I'm going to use the back of my hands to check, to feel for your temperature, and it is warm to touch. Okay, so I'll be checking your leg for edema, and I'll start from all the way from close to your knee here down to the extremities, right? And the indentation, we'll be rating it if it's 1 centimeter based on how deep we go, or 2 or +2 thereabout. But for now, I'm not seeing any sign of edema. Let me know if you feel any discomfort in any of this. And then usually if there's edema, it takes time for your tissues or your cells to bounce back once we palpate it. Okay. So for now, I'll be checking your dorsalis pedis, and because I want to take the pulse, feel for the pulse on the front and also on the back of your leg. So we will find out between the thumb and your first big toe here. It's just right there in between, and I'll be doing that simultaneously on both of your feet, on your feet actually. Okay, it is strong. I'll say this is a 2 because it's actually very strong and I can feel the pulsation. And I'll be checking at the back here too. So this I will give a 1. I'll give a 1. I'm not really feeling so much of the pulsation at the back, but and now I'm going to be checking for your motor reflexes on your head, and I'd like you to push against my hands. You know, imagine that you're pedaling down. Okay, that's good. And then try to also push up towards my hands. Okay, that is strong. That's very good. Annette, can you wiggle your toes for me, please? Okay, thank you very much. Your muscle is strong. Okay, Miss Annette, I want to do a capillary refill on your toes. I'll be touching your toes, okay? Okay, your capillary refill is less than 2 seconds, okay? And now I'll have to do a motor sensation test on your leg. So please, if you can push like in a pedal style against my okay, can you push against? Okay. And I'll be lifting your leg. If you can push against, okay. And then try and push forward. Okay. So your motor responses are strong. Can you close your eyes for me?
Okay.
Yes, I want to test for a sensation. So please, you tell me what you feel. Is it weak, dull, or hypersensitive?
Normal.
What about here? Weak, dull, hypersensitive?
Normal.
So is it the same? Are you feeling the same in both
Yes.
legs?
Yes.
Okay. What about here?
Yes.
Is it
feels low.
hypersensitive? Is it dull? Is it...
It feels hypersensitive.
Okay. I'm going to document everything when I get back to the doctor, and we'll let you know, okay?
Okay.
So now I'm going to leave you, you know, with your bed rails off, and your cowbell will be within reach. Do let us know if you need any other stuff. Thank you very much.
Thank you.
Hello, Ramatu. How are you doing today?
Hi, doctor. I'm good. Thank you very much.
All right. Can you tell me something about Annette?
Yes, so Annette is a patient with significant swelling in her right leg, accompanied by severe pain and redness. The leg actually has been swollen and she reports increased discomfort, especially when she's walking, you know, or she's standing. And then she's also afraid of the possibility of a blood clot.
Okay. All right. Thanks for briefing me on the situation. What's the background?
Yes, Annette is a 45-year-old woman. You know, she has a history of high blood pressure, hypertension, and she recently has been immobilized after her surgery. She's also allergic to penicillin and dust.
Okay, so upon assessment, what did you get from it?
Well, the right leg actually appears significantly swollen. It is warm to touch, and there's visible redness, especially in the calf area, you know. And she also is experiencing, there's also decreased sensation and tenderness when we palpated the swollen region and did a sensation test.
Okay, great. And so, what do you recommend I do?
Well, we're recommending that immediate evaluation by a healthcare provider and probably have a Doppler ultrasound, to assess for possible DVT. And additionally, too, the patient has to be keeping her leg elevated, probably on a chair, or a table whenever she's in bed or she's sitting down. And then there should be further investigation into her cardiovascular or blood clot history. That's what we recommend.
Awesome. Thank you so much, Ramatu. I'll take it from here.
Okay, thank you.